Hello, and welcome to the New Rules of Sex Summit, your sexual re-education. My name is Dr. Lauren Brem, and I am here today with Dr. Brandye Wilson-Manigat, board-certified OBGYN, libido coach, and founder of Life, Love, Libido. Welcome, and thank you for joining our summit.
Well, thank you for having me. I am very excited to talk about all things women's sexual health today.
Yes, this talk is for the women and for other men who want to understand women and our reproductive systems and our libido, which is important. So we're going to dive into libido, but I want to start, because you are a board-certified OBGYN, to just talk about the basics of gynecological health. So some women aren't even seeing the gynecologist or the midwife. You know, they're not like, they think if they just don't look at it, like it won't haunt them. But like, what do you want women to know about how to maintain excellent gynecological health?
Well, I think first and foremost is just maintaining overall general good health. Exercising, eating well, taking your multivitamins, and just being aware of what your body does, what it's saying to you. Because a lot of times, like you said, we totally, just cut off that part of ourselves and we aren't paying attention to what is happening. So just awareness, specifically for the gynecologic health, I would say if you feel a lump, if you have any weird bleeding, if you have anything that is out of the ordinary, come in and see us. Mm-hmm. There's a lot of stuff that you should be worried about, but for the most part, a lot of the things that people come in and they're like, hey, well, I have this bump or I have this thing and I think I'm going to die. What do you think? And it's like, no, you're not going to die. You are, you're just having this thing and we can treat this thing and then you'll be fine. Mm-hmm. So there's a lot of anxiety, I think, about going to see the gynecologist. One, because of the thought process of, oh, something's wrong, I'm going to die. Yeah, but there's also in our mind. Right. Yeah. And then if you go on Google, you have cancer for whatever symptom you see.
Google's the worst place to go.
Right.
Those Yahoo chat rooms.
Right. So stay off Google. But just coming in and seeing us and letting us be able to diagnose what's happening. Mm-hmm. And then specifically for just keeping the genital area kind of in its optimal health, not using a lot of scented or perfumed products or products with a lot of dyes, just because it's a sensitive area. Mm-hmm. And the things that you use down there can cause infections and cause changes in the pH of the environment of the vagina. It can cause changes to the skin and give you rashes and itching and things like that. Mm-hmm. So being careful with the products that you put there, mm-hmm. being careful with the people that you allow to be there as well. Mm-hmm. We try to educate our patients about the risks of having multiple sexual partners and what that can mean in terms of risk for infection such as HPV, which can sometimes lead to cervical cancer and things of that sort. So just being mindful of, just like we're mindful of what we're putting in our bodies, being mm-hmm. mindful of what we expose our genitals to. Mm-hmm.
Yeah, and a lot of people listening to this summit do have multiple sexual partners and do use condoms or other forms of protection. And, mm-hmm. I think, with HPV, most of us have it, and it is something we need to get regular pap smears for, right? Because the body will heal it in most cases in 2 years, but you just need to kind of check your cervix, right? And make sure that there's no funky cells there. Or if you develop a wart on the vulva or on the genitals, that it needs to be removed, right? Because it can pass on to your partner.
It's true. And the tricky part about HPV is that sometimes you can have kind of flat warts that you don't even know are there. Okay. And so you can transmit the virus from having those, but definitely if you do have something that's visible, mm-hmm. come on in and let us take a look at it, let us take it off. And yes, continue getting regular pap smears. I know our guidelines these days are like, oh, every 5 years, if you have a positive or if you have a negative HPV test and a normal pap smear, you can go up to 5 years. I am not a proponent of that. I like to keep an eye on what's happening and keep an eye on what is going on.
Also, did
On
it go from 3 years to 5 years?
Mhm.
Oh, I didn't
Mhm.
know that. Okay, I thought it was
Yeah.
every three if you had a normal pap.
Yeah.
Yeah, that's a
Well, if
long time.
there's some things that there's some stipulations. If it's just a PAP, then yeah, every 3. If you
Okay.
do, but most of the time we do PAP and HPV. So if we're doing PAP and HPV, theoretically you can go 5 years without having to have another one.
I see.
But I usually say come on in and see us every 1-2 years. Even if we don't do the PAP, if we do a pelvic exam, if we do
Yeah.
a check just of the outer genitals, the inside,
Because like you said,
we're
sometimes we
checking
don't know
everything.
there.
Right.
Yeah,
We're
we can't
checking
see everything.
everything.
Yeah. Well, and I know
Mhm.
at Planned Parenthood that a lot of women will use for gynecological health, they don't even look at your genitals or do a pelvic exam if you don't complain of some problem
Mhm.
or you're going for your pap smear. So you might never even be getting checked out. And it is
Mhm.
really affirming, and like it gives you such a good feeling when you go and just have it looked at and know that everything's good, or when you
Yes.
address what you're afraid of and then be like, oh, that's just a wart, we're just going to take that off, or oh, you have
Mhm.
chlamydia, like I have an antibiotic for that, or just like
Mhm.
addressing the problems and not waiting so long so that they develop into something. Chlamydia can get into your fallopian
Mhm.
tubes, and HPV can and some develop into cancer. So
Mhm.
I know. I was just talking to a friend the other day, and she hasn't been to the gynecologist in a long time
Mhm.
because of fear of what will be found, but also because she's had bad experiences. So what do you say? I mean, you must see that a lot. Women who are traumatized by their OBGYN or some
Mhm.
healthcare provider. How do you help them get over that?
Well, I think first and foremost, I try to come in and not make it seem like I'm rushed. So I'll come in, I'll sit down, and I'm like, okay, so what brings you in today?
Mhm.
And then, we talk about what's been going on and all the things that the associated things that are happening with that. And then as we do the exam, I literally talk through everything that I'm doing, so that you're not in the dark and just laying there like, I don't know what this person is doing to me and what's going to come next. And then, if someone is having trouble, we go slowly. We
Mhm.
use what we need to do. If we need to use a little bit of lidocaine jelly, we can do that. If we need to use just a finger first versus the speculum,
Mhm.
it is it's a very unique situation to be in when you have someone who is afraid of what's happening and
Mhm.
what's going to happen.
Because
And
literally their
usually,
physiology, like they can lock the vagina can lock down so tight you can't get
mhm,
anything in there, right?
yes, exactly, exactly. So I just try to stay calm. I try to keep the patient or the client calm.
Mhm.
And usually when I'm done, they're like, oh, that was it? Like,
Mhm.
I've never had a gynecologic exam that was that good.
Mhm.
And it's like, it's weird to say, and they'll say it's weird to say, but that was great, thank you. So
That good for you? Because it was good for me. Yeah.
right, so
Yeah.
just trying to keep things calm.
Hmm. And
Yeah.
what about with STI testing? I don't know if you're working with women who are more in monogamous relationships and maybe get tested less, or people
Mhm.
that are out dating different people. And what do you recommend for the standard STI tests?
Well, I take it on a case by case basis because, like you said, there are some women who are in totally monogamous relationships, and they don't necessarily need it, but they do come in and they're saying, "Hey, I just want to be sure. I don't suspect anything. I'm not having any symptoms, but every year I just want to get checked." And I'm like, "Okay, I'm with that because you never know what is going on."
Yeah.
And then I have, my other patients and my other clients who are having sex with multiple partners, and we talk about, okay, these are the things that you need to look out for. These are the things that I recommend in terms of safety. So condoms, dental dams, all that stuff. And then just educating them and saying, listen, when we do this testing, it literally is just a point in time. So if there's any exposures that happen after this, it may not pick it up. If we're in that window of time where whatever process is happening hasn't literally started to make any discernible changes, we may miss something. So sometimes I'll tell patients to come back in 6 months and we repeat the HIV test or repeat some of the bloodborne things like hepatitis, to make sure that once we say, yes, you're good, we know, okay, you're good. And so it really is just, it's very individual. And then there are some times that patients are coming in for other things. So they're like, well, I've had this discharge. It doesn't smell, it doesn't itch, but it's just there all the time and it's different. Or, I'm having bleeding in between my periods, or I'm having bleeding every time I have sex. So there are certain STIs like chlamydia, and also trichomonas that can give you some of those symptoms. And so then I'll check for those to make sure that we rule that out exactly.
No, I think that one of the STIs that still has all the fear, because there isn't just that antibiotic that can whisk it away or whatnot, is herpes. So how do you, and it's another reason people can avoid the doctor, because they're like, I don't want to know. So how do you talk with a patient when they get a herpes diagnosis? What does like managing those symptoms look like? And I'm curious how you respond to that.
Well, first we start off just talking about, okay, how the transmission process, and knowing that it is a skin-to-skin transmission versus a bodily fluid transmission. And so that has implications in terms of being able to protect yourself from getting it, but also protecting future partners or current partners and future partners. Herpes doesn't just reside on the penis or inside the vagina. It can be in any place around the genitals, to the thighs, the buttocks, all those areas. And so even though condoms are good, they are not 100% in terms of that. And then in terms of what now, because that's usually the question, like what now? It's okay, you need to discuss it with your partner and let them know that you have this diagnosis. They probably should come in and get testing. We should test you for any other sexually transmitted infections as well, because sometimes they can travel together. And then we talk about the likelihood of this being something that will affect your like day-to-day life, month-to-month life. And usually with herpes infections, the very first infection is the worst. And then, right, the most painful, the most lesions that we see. And then over time, they become less frequent, they become less painful. And with that, though, there is the option for suppressive therapy to treat it, and to minimize the number of outbreaks that you have, because for some people, like just having your period, just the hormonal changes of your period will make you have an outbreak every month. For some people, it's stress, and stress just makes it come. Especially if you have a high stress job or something like that, you're like, I'm having an outbreak every 3 weeks. What is going on?
I've heard people do that with foods too. They eat nuts and chocolate, certain foods, and they'll have an outbreak.
Yep. Certain foods also can trigger it. Major illnesses, so if you get the flu or a really bad cold, that can make things come out as well. So for those patients, we talk about the availability of suppression therapy. We also talk about using like a lysine supplement, because that has been shown to decrease the number of outbreaks if you're taking that every day. So I usually try to give patients the clinical and then kind of the homeopathic almost method for how you can help yourself and prevent you
And
from having as many outbreaks.
yeah, and can you use the suppressive therapy? It's an antiviral medication. Can you use that prior to, like, a week prior to having sex? Or how does that work at where you time your sexual interactions? And how do you know when you're not in the, because
Yeah.
dead before you
Mhm.
have the outbreak, so you can pass it even when there's not a sore there. So
Exactly.
how do you
Exactly.
approach
So
that?
I usually tell clients and patients, if you're going to be on suppression therapy, it's not like, oh, okay, take it as a spot dose here before you're about to have intercourse, and then after that you're fine. What I usually recommend is that you take it daily for a good 6 months to a year. And then once we're done with that course, we can take you off of it and see how you do in terms of outbreaks, number of outbreaks. The shedding of the virus is the highest when you actually have lesions and you have an outbreak.
Mhm.
But you can shed lesions at any point, and there's no rhyme or reason to it. They've
Mhm.
tried to look at, okay, is it just for a few days, a month, or is it, this period of time after the infection and then it goes down? There's
Mhm.
nothing that we know to say, okay, you have it you'll shed it on Tuesday, and then
Mhm.
you won't shed anything until Friday, and then you won't shed anything again until Monday. There's
Mhm.
no rhythm to it. So
Mhm.
you potentially are shedding at all times. So we tell you to take the suppression therapy every day.
So if you're having sex with someone with a genital herpes diagnosis and they're on the suppressive drugs,
Mm-hmm.
like, you're using a condom, and as long as there are no open sores, your chances are pretty low of, and assuming your immune
Mm-hmm.
system's good as well. Is that safe to say?
Pretty much,
Yeah.
pretty much. Using that daily suppressive therapy tends to make the viral load so low
Hmm.
that the risk of transmission is down there. I'd say less than about 10%.
Okay. And are there side effects to taking this antiviral medication?
There are a lot of medicines that we take are cleared through the liver, and sometimes they can cause inflammation in the liver. And so,
Mhm.
before starting anyone on a suppressive regimen, we want to check your liver function test to make sure that they're okay and that your liver can handle it.
Okay. And if someone wasn't on the suppressive drugs but wanted to started dating someone new, wants to start having sex and wants to really minimize outbreaks and get below that 10% transmission rate, how long would they need to be on those drugs before they, started having sex?
Um, I don't know that they necessarily have any data about that,
Hmm.
about the timing. Like, if you started at this time, it's a little different than like a birth control pill, where you're like, if you started here and you're starting with your period, then in 2 weeks you should be protected and you're good.
Hmm.
There's not anything specific that we can say, okay, once you've been taking it for a month, you're in the clear.
Okay. So there's no data yet on that. That's interesting.
Yeah.
And I've also read some research that when you have an open herpes sore, you're more at risk for transmission of other STIs like HIV through that,
Hmm.
that direct entry into
Because of that direct entry point.
the
Yes.
mucosal membrane. So you have to be more
Hmm.
careful during that time as
Hmm.
well, not only for giving it, but for things that you might receive.
Correct.
Yeah.
Correct.
Yeah. Well, that's good news. We have these suppressive drugs then, and
I know.
and, and access to healthcare to really take care of not only our pelvises, but also our breasts. And you recommend breast exams. How often? What's the current?
The current recommendation actually is if you are in the low risk population, so meaning you don't have any personal history of breast cancer or first degree relatives with breast cancer, that you don't necessarily need a breast check. Again, I am of the mind that you should be aware of everything that's going on with your body, and you should have a check on a regular basis. So again, every 1 to 2 years.
Checking for lumps, just manually.
Checking for, yeah, just doing a manual exam. If I have patients who are in that high risk group,
Mhm.
I usually will also recommend that you do self breast checks once a
Mhm.
month.
Mhm.
So one, just to be aware of what your normal feels like, so that if something is out of the ordinary, you can catch it pretty quickly.
Mhm.
But yeah, doing those self breast exams once a month, and then having a clinical breast exam. And for those patients, they should come in and have a clinical breast exam once a year.
Okay, and that continues throughout life.
Mm-hmm.
Mhm.
Mm-hmm.
Yeah. Okay. So I think we've covered the genitals, we've covered gynecological health. So now we can get into the good stuff, because not only do you help people
Yay!
get healthy and address, any infections or anything that's off in the body, but you help women reconnect with passion and desire who say they have no libido. So I want to
Mm-hmm.
hear how you do that, because I hear so many stories of women with no libido, their poor husbands like don't get any sex, the women themselves like don't feel good about
Mm-hmm.
themselves, they just know like something's off. So how do you help women get back in touch with this?
Well, I think it all starts with questions. I think for most of us, we are kind of going through life just on autopilot. We are doing our usual routines and just going from this to this to this to this. And we're not stopping to check in with ourselves. We're not stopping to check in with what we need, because as women, we're givers, and
Mm-hmm.
we're trying to give all that we have to show our love to the people in our lives. And then we're working and having other things that we are taking care of in addition to the household things. So I think first and foremost, just acknowledging to women that, you know, I see you and I hear you,
Mm-hmm.
and I know and understand what you're going through. And then the second part is just starting with some awareness and with some teaching and education. So I'm talking to women about, okay, as you get older, your sex drive actually goes up for women. For men, can go
Thank
down, but
you.
not
Thank
much.
you. Yes.
But for women, it goes up.
Mm-hmm.
And if it's not going up, and if you're seeing that it's going down,
Mm-hmm.
that's an issue. That's a problem. Most women, when they come in and they actually bring it up to me, they are asking for hormones to be checked, because they're like, I'm going through menopause because I don't want to have sex. And it's like, no, that's not what menopause looks like at all. And it's not your hormones. The number one thing that I find for women in terms of decreasing libido or no libido is fatigue.
Mm-hmm.
It's just being absolutely exhausted.
Mm-hmm.
And if you're absolutely exhausted, there's no way in heck that you are going to want anybody to take anything else from you, because that's what it feels like. It feels like somebody is taking more from you than what you have to give.
Mm-hmm.
So first and foremost, we talk about, okay, what is your schedule like? Where in this schedule can you even take 5 minutes to breathe?
Mm-hmm.
Just 5 minutes of closing your eyes and taking some deep breaths and just stopping and becoming present
Mm-hmm.
in where you are. Because so many times we're 2-3 steps ahead of where our body literally is.
Mm-hmm.
How can you get to a point where you are here
Mm-hmm.
in the now? I talk to women about using adjunctive things like essential oils
Mm-hmm.
to help with well-being, to help with just being present, to help with relaxation. Because
Mm-hmm.
for some women, the no libido or low libido is fear.
Mm-hmm.
Fear that they won't be able to perform,
Mm-hmm.
fear that it's not going to feel good anyway, so why am I bothering to even do this?
Mm-hmm.
And so things like lavender and bergamot together, frankincense even, a
Mm-hmm.
really good kind of grounding scents that if you diffuse it in the air, you put a couple drops in your hand and just inhale,
Mm-hmm.
they really do help to decrease anxiety and decrease that sense of fear
Mm-hmm.
about what is coming and what is going on.
Mm-hmm.
We talk about what things you can do to actually raise your energy levels,
Mm-hmm.
like exercise, just 10 minutes of walking out in nature.
Mm-hmm.
That does wonders for your mood, does wonders for just physical activity
Your
that
orgasm. Wasn't
motivate.
there some research
Mhm.
that showed women that exercise have better orgasms? I forget if it's
That too.
more
Yes,
pleasurable or
that too.
yeah.
Mm-hmm. And then just with some women, it is a matter of, I don't feel anything, so I don't want to do this. And so we talk about pelvic floor exercises that you can do to strengthen those muscles. And that allows you to have a little more friction. And that friction is what allows you to have stimulation for orgasm. And so there's a kind of a broad base of things, but just awareness and asking questions. What's happening? What have you tried in the past? Because a lot of times it's like, well, I've tried the lingerie, I've tried the naughty stories, I've tried the toys, I've tried this, that, and the other. And it's like, it works for a little while, but it never lasts. And I tell women, you know, your brain is your biggest sex organ. First and foremost, if you're not turned on mentally, and that's not even, I'm not even talking about sexually, just turned on mentally in your life. So you're doing things that are stimulating your creativity. You're doing things that are fun, not just what you have to do, but things that you want to do. Taking a new class, going bike riding, doing something that is different is what helps to really bring you back into your body and bring you back to a place where you can enjoy not only life, but enjoy sex.
Yeah, create some resources and time for yourself. When you're talking about these perimenopausal women saying, oh, my menopause is killing my libido, it's making me think about the women that I coach that come to me who have just had babies, and they say, oh, I just had a baby, I have no libido. And I'm like, I had a baby and my libido didn't go anywhere. So, but then I dive a bit further and hear, you know, their husband isn't changing any diapers. They have like no family helping them. They've got all this resentment and rage. And the first step is just saying, I see you. And, you know, usually in seeing them, then the tears fall. And then, you know, I do a little bit of hands-on work with them and the baby. And then we have to like make some changes. Like, you've got to set some better boundaries. You need to get help so you can go to the gym, so you can have creative time. And then their essence, their own self starts to flow. And then there's the possibility of libido again. And sometimes they've got so many resentments with their partner. There's nothing wrong with their libido. They just don't want to have sex with that person.
Exactly.
There's definitely, some things to figure out and all of that. So, you know, I want to talk a little bit more about the perimenopausal transition. Because, you know, you said such a thing that I say all the time, which is, you know, your sex drive goes up after menopause. So what's this whole cultural story of that you dry up and it's all done, you know? And so, yeah, what do you want to educate women about with that?
Well, I think it's kind of multifactorial, and part of it starts with just how we are sexualized in a sense, and how we are made to feel about our bodies and made to feel about sex in general. It's this whole taboo subject that no one wants to really talk about, but it's out there all over in everything, selling everything. And it's like this push and pull of, yes, I want to be sexual, but I shouldn't be, because if I am, I'm not a good girl. And then the other part of that has to do with this idea that sex is just for procreation. It's just to make babies. And that is not the case. Sex is not given to us just so that we can make other humans, although that's part of most of our basic desires and needs. That's not the only purpose. I believe God made sex for us to enjoy our bodies. And that extends well into the later years. And so I think there's this, I don't want to call it a myth, but I think it is this underlying belief that we should not have pleasure from this, and that it's only for this one thing, and it's not.
Yeah, well, there were thousands of years of telling that story that sex was only for procreation. And so, you know, and you got married right after you got your period, and there were all these, you know, taboos to keep you only having sex to procreate. So it makes sense that even though we're free of that, we're not quite free of it. It's still like an underlying story that if I do enjoy this or am too sexual, I'm bad, and therefore I can't get love. And our basic needs to be loved and safe and all of that. Yet sex is also a basic need. So you get a lot of a lot of conflict. Yeah.
There is.
So when
Definitely,
women
definitely.
when women are going through that transition, because a lot of cultures recognize, I mean, they do a lot better job at recognizing in a lot of cultures the transition through puberty and the sort of rituals and celebrations with that. And what would you say is a way that women can honor, or what should they expect if the story's wrong that your libido goes away? What else is incorrect? What really could menopause, that transition to menopause, be for women?
I think it really could be a transition into freedom.
Mm.
A lot of times, when women are going through perimenopause, they either have children who are about to leave the nest, or
Mm-hmm.
they've already gone out of the nest. And in a sense, they have an opportunity to reinvent themselves, or to not even reinvent themselves, to reintroduce themselves to themselves,
Mm.
to go back to who they were before all of this,
Mm-hmm.
and enjoy going back to a place where, oh yeah, I do like this. Oh yeah, I know what I like. I know what I want. Because in all of that mix of day-to-day life, a lot of times we forget what it is that we even like. We forget what it is that we want. We forget what it is that makes us feel good.
Mm-hmm.
And to be able to focus on yourself and be able to say, I like this, or I don't like this, and I don't want this anymore.
Mm-hmm.
And kind of draw a line in the sand and say, hey,
Mm-hmm.
this is how I want my life to be, and then go about creating that.
Mm-hmm. Yeah, I think that's one of the gifts that I see with getting older, is that you just get more clear on who you are, what you want, and I don't want to waste any time doing stuff for other people that I don't really want to do, or you just get clearer. So I imagine, I haven't been through menopause yet, but I imagine
Mm-hmm.
that it is quite a, and I see men go through this big shift at the same age too. Like I watched my father, I
Mm-hmm.
was like, he's going through menopause. Like he changed, his hormones changed, like his way he related to the people in the world. He was softer. He was, a bit different.
Mm-hmm.
I think, again, we honor that in boys and girls. I love the bar mitzvah and the bat mitzvah and the Jewish tradition.
Mm-hmm.
And like honoring, like you're stepping into adulthood, and now we're like stepping into something else. And yeah, your sexuality can change. I've also read things about when you don't have kids in the house anymore, set so many people free, because
Right.
like I can't make sound and all of that. And I've also heard studies where women have more free, fun sex on vacation because they're just not
Mm-hmm.
worried about someone walking in the door.
Right. And I mean, even with that, it's a different environment. It's something totally outside of the norm. And so
Yeah,
it
the
it is,
novelty.
yeah, it is a very freeing sensation. And
Yeah.
yeah, I can definitely attest to the kids and being afraid of them hearing some things happening when you're getting busy. It's like, oh man, I gotta be quiet.
Yeah, a reason to maybe buy like some really loud white noise machines.
Right. I think I might have to get one.
I got one when my daughter was born, and I still use it all the time.
Okay.
This thing is amazing. Where was this my whole life? Yeah, I needed that
Mhm.
a lot earlier. So, women can have low libido even as young teenagers, early 20s. Like it can come up anytime throughout life, like we talked about pregnancy, postpartum, menopause. And yet we humans are designed to enjoy sex at every age. So,
Mhm.
again, what would you say, just as a libido expert, for a woman if she, can't get to your office? What would be
Mhm.
kind of a conversation to have with herself, or something to do to explore where that went?
Um, I am a big fan of journaling. Um, just writing out what your thoughts are, whether it be asking yourself the question, why don't I like sex? And if
Mm-hmm.
whatever your answer is, well, why is that?
Mm-hmm.
And the next answer, well, why is that? And just kind of getting down to the bare bones of what is going on.
Mm.
Asking a question, you know, when was the last time that I enjoyed sex? For
Mm-hmm.
some people, it's never. For
Mm.
some people, you know, there was a time where you enjoyed it, and exploring, okay, what was going on at that time? Who was I with? Did I enjoy that person? What was my life like? What was I doing in addition to sex?
Mm-hmm.
What things were happening around me and in me that you can connect to and
Mm-hmm.
say, yeah, at this point I did like it, and now there's a change. Like for
Mm-hmm.
me, when, and I developed this work and started doing this work, one, for because I was having clients come in, but also because I have been struggling with it and had been struggling with it for a very, very long time, since my 20s.
Mm-hmm.
And it was like, well, for the longest time, I thought I didn't even like sex.
Mm-hmm.
And, you know, after I got married, and my husband would be like, you know, we'd have discussions, and he would be like, you know, you don't like sex, and I do. And I kind of internalized that. And then one day it was just like, well, how can I make this better if I don't even like sex? And it's like, well, who said you don't like sex?
Mm-hmm.
And I'm like, oh yeah, I do like sex. What? Hold on. Wait a minute. Wait
Yeah,
a minute.
like a story.
So yeah, the stories that we tell ourselves
Mm-hmm.
are what influence our further thoughts and behaviors.
Mm-hmm.
And once I got past that point of, okay, wait, I do like sex. So what is going on? What is the dynamic that I don't like?
Mm.
And being able to identify where kind of in the process things break down.
Mm.
Because I knew once I got in the mood and
Mm-hmm.
we did it, oh, it was awesome. I
Yeah,
loved it. But
yeah,
it was overcoming those hurdles to get there.
yeah.
So I think just questions, asking yourself, what are you feeling? What are you thinking? And not
Mm-hmm.
stuffing it down
Mm-hmm.
and saying, no, that's not right. I shouldn't feel this way. Really taking the time to feel it and acknowledge it, and
Mm-hmm.
then
Mm-hmm.
figuring out what needs to happen next.
Yeah. Yeah, questions are so powerful. This last year, I created a workbook for my first book, The New Rules of Sex, and it's all questions.
Ooh,
Just take
okay.
that like journaling process and look at your sexual history and your life. And just as you're
Mhm,
talking, I'm remembering there was a period where I was like 19, 20, and I had zero libido. I didn't know what the word libido meant. And I remember when the
mhm,
doctor, someone said, "Do you have any libido?" I was like, "What are they saying? I don't know what that word means." But I
mhm,
realized, like, oh, yeah, I haven't masturbated. I haven't had a sexual thought. I mean, but it was convenient at the time. I was living in New York
mhm,
City. 9/11 had just happened. I was like really stressed out financially. Like I wasn't
mhm,
eating well. Like all of, wasn't sleeping well. And so, yeah, the
mhm.
libido just went away.
Yeah.
And, just like when I was malnourished and working out a lot, as I used to dance professionally, and my period went away. Like these things can just
Mhm.
go away at times
Go away.
back when you start to like create the environment. And I also had a lot of
Mhm,
sex negative programming from my
mhm,
upbringing and all of that I had to work through. And so yeah, but I think to ask those questions, to journal, to talk to people, to get education like online programs and books and things that talk about sex in a positive way. And that's why I wanted to create this summit, because just hearing conversations that are sexually empowering give you permission. I mean, just saying
mhm,
I realized I liked sex, I mean, that's revolutionary for a woman to say I like
mhm.
sex. I mean, it's so powerful, just that simple phrase. When you
Yeah.
look at medical textbooks from 100 years ago that said healthy women have no sexual desire.
Mhm. Exactly.
Yeah, I mean, straight up in the medical textbooks, yeah, healthy women don't have any sexual desire.
Mhm,
It's just something that men take from them, and they're just
mhm,
making babies, and it's like no wonder we have like all this rage and difficulty kind of finding our sexual identity and finding equality. And but to be like, just to say I like sex is such like a beautiful place to kind of start. And if the answer is like no I don't, to start asking more
mhm.
questions.
Exactly. Exactly.
Very cool. Well, how can people find you online and learn from you and follow your work?
Well, I have a website. It's called www.lifelovelibido.com. On the website, I have some blog posts. I have listings for events that I do periodically. If you're in the LA area, I also do what's called private girls' night out sessions, where I come to you and you get 10 of your girlfriends together, and I'll come out and we talk. We talk about all things women's sexual health. I have diagrams so we can talk about anatomy and all the different points in and out of the vagina that can bring lots and lots of pleasure and orgasms, because I love talking about that.
Yeah.
We talk about vitality and what that means, and not just the physical and the mental vigor, but also the sexual vigor and how that will play into your confidence as a woman, your creativity, and all of those things. And then for this particular event, I would like to offer something called pleasure in perimenopause, because I think this is a special time period, a special transition, that there's some things that I can do to kind of help women to really hone in on the physical, the emotional, the mental, and the spiritual aspects of their sensuality and their sexuality, so that we can upgrade that experience, that sexual experience that you have at this time frame. So I would like to offer just a 30-minute session with me for free, so that we can talk about all things that could potentially be blocking you, and also give you some ideas about things that you can use to amplify that energy that you have, that sexual energy, so that you can then essentially display that to the world, and not let it be, trashy or anything like that. It just be you standing in your confidence and being sexy. And so you can sign up for that at bit.ly, bit.ly/Peri Pleasure, PERIPLEASURE.
Cool. Well, thank you for that. That's awesome. I like words like upgrade and amplify when it comes to your sexuality. I think those are very good words to use. And thank you so much for your time today. I've been searching for years to find an OBGYN that also talks about sex. It's surprising how hard it is to find someone that is willing to have both conversations with you. So I was so excited when I found your work, and that you're helping women, not only with their gynecological health, but with libido and really their relationship to themselves, their sexiness, their sexuality, their pleasure, the right to have pleasure. So thank you so much for joining us today. That's really great.
Oh, thank you for having me. This is my passion. This is what I love to talk about and love to do. So I'm so blessed to be able to do that in this space. So thank you.
Awesome. Wonderful. Well, thank you everyone for joining us, and we will see you in the next interview. Bye-bye.
All right. Bye-bye.